Hi, I'm George Russell, but you probably already knew that. And I'd like to show you some techniques you can use for the knee. Many of you may not know that in order to bend and straighten your knees, which is the main thing we think of the knee doing, I think that's the main thing. In order to do that, you need to also rotate. When you bend your knee, the tibia rotates outward, and when you straighten it, it rotates back in. And so rotation is usually the primary restriction when a person has trouble bending and straightening their knee. So that's where I'm going to go first. Can you slide a little back on the table, Dan, but have your knees swinging? Yeah. So Dan actually happens to have some pain here. He just told me that, so I'll probably try to deal with it, and it won't help, and then I'll feel like a jackass. But on the other hand, maybe we'll learn something. So what I'm going to check here is how his leg turns in and out. In fact, I can do that actively. Can you turn your foot in and then turn it out? Good. So, of course, they're not turning their foot. They're turning from the tibia. So I'm going to watch the tibial tuberosity. So turn your foot in and turn your foot out. He's got a little bit of external rotation of the tibia and almost no internal. So now I can test it myself. I can take the slimmest part of the tibia and turn it in and turn it out. So in passive motion, he has a little bit more, but he's restricted on both ends. And the way I feel that is that it's a thickness at the end. Instead of being kind of free floating like a lazy Susan, if they use that term anymore, or a rotary or something, it's more thick, like pushing into a mattress. So this is restricted, and we're going to try to work on that. That's the rotation I'm talking about. Can you just stand up and bend your knees, Daniel? And then I want you to rotate. Oh, that's too much. Just a little bit. Yeah, athletes always have bent knees. You probably noticed that. So turn towards, keep them bent. Turn towards the mirror. But keep your feet on the ground. Okay, turn towards the mirror, but keep your feet on the ground. His knee is externally rotating here and internally rotating here. Turn to the other direction. All the way. Turn all the way. This is now internally rotating, and this is externally rotating because the feet are planted. Okay, so those are the major ways that people tend to get injured. I'd like you to lie face up on the table. Thank you. Most of you will be testing this on the table, so I'm going to show that technique. I wouldn't really stand here. You could stand at the side, but I want you to be able to see it. So here, you'll have your finger on or your eye on the tibial tuberosity. And Dan, will you turn your foot in, please? Good. And then you'll have him turn it out. And you can see he turns out a good deal, but he doesn't turn in very much. Okay? So I want to correct that, because in order to move passively from the knee, in order to really be able to move at all at the knee, he has to be able to do this. So for this, there are many ways to do it. If you're so inclined, you could sit on the table, but you could also have them up on a bolster or something like that. So I'm going to feel on the two sides of the patellar ligament. I'm going to put my fingers here, because underneath these fingers are the menisci, which ride on the tibia. So they have a big impact on rotation. And even the word meniscus, feel free to weep or moan. Okay? So he turns pretty well to the outside now, but not to the inside. So I'm going to, and I feel the meniscus not moving back. This should hollow when you externally rotate. This should hollow when you internally rotate, because it's riding on the tibia. So I'm just going to put my finger here, and I'm going to push, with respect to the kneecap, I'm going to push straight anterior to posterior. So I'm just going to, you might say, milk it. I'm trying to get the meniscus to go that way, and I'm just turning in the tibia. Let's see if it has any effect whatsoever. I might want to bend his knee more, because the more it bends, the more the knee frees to do motion. Okay, I'll do that a little bit. So now, Daniel, I'm going to put your foot flat again, and I'd like you to externally rotate, turn your foot out. That's what you'll say to the client. Good. And turn your foot in. Now it goes. Can you see that? It moves a lot more this way, and he may or may not have less pain. I mean, are you feeling it now? Just briefly? Like yes or no?
A little bit.
Okay. So maybe this will be better for him. We don't know. Now, there's another thing you can do, because two muscles that really impact the knee are the hamstring and the calf. So they can pull on the back of the knee, and that can cause some pain too. You know a million ways to work on the hamstring, but there's something you can give people at home, which is really great. Now, there are a number of tools you can use to do this, and they're available at the Sharper Image. They're extremely expensive, of course. And while you're there, you might also, I've noticed that they have a little unicorn that can fly. So you might want to get that too. It's, it's pricey, but it's worth it. So I'd like you to, I'm going to use a substitute thing. You may want to use the substitute. Can you come on all fours, please, Daniel? Just turn over. Mm-hmm. I'm going to use a rolled up towel, which works just as well as something expensive, but you know, I was teasing you. Can you walk forward with your hands a little bit? Now I want you to put this in the back of your knee, Daniel, and I want you to use your hands to make sure it stays absolutely in the knee crease. So as you go back, you want to keep it in the knee crease. You use both hands once you take your weight off them. Yeah, now pull them both forward as hard as you can. You can take them as a handle so you get them right in there. And now go back and sit on your heels. Now what this does, can you come to this side, is it tractions the knee open from the back while also releasing the hamstring and the calf. Sometimes I have people do it with a foam roller, and that's usually excruciating, but it may be helpful. So this allows people who can't bend their knee so much to bend their knee more because the knee joint is being tractioned open by the towel. At the same time, it's releasing the hamstring and the calf. Okay? I'm going to show you one more place you can put it. Can you come up a tiny bit? You can put it on the Achilles tendon, and then you can come back. You can calibrate it so that it's on the Achilles tendon and it's also just below the ischial tuberosity. So it's on the hamstring tendon and it's on the Achilles tendon, and that can be extremely helpful for the knee, as well as, of course, for other things. Okay? So try these things if you feel like it, and then let me know how they work if you feel like it, and have a great day.